Yeah, good morning everyone. Today we will be taking the class on classification of malocclusion. So today we will be discussing the roadmap of classification, that is what is the malocclusion and what is occlusion, and we also talk about the need or uses of classification, then the system of classification and terminologies. Then we'll come to the angles class 1 and class 2 malocclusions. Then we will discuss about the Andrews 6 keys to occlusion, and then we'll come to the lastly the skeletal classification and British standard classification for incisors. So what do you mean by occlusion? When the teeth in mandibular arch come in contact with those in maxillary arch in any functional relation are said to be in occlusion. This is given in Wheeler's book, and according to the Wheeler's, this is the occlusion definition. And what do you mean by malocclusion? So it is very simple. A condition in which there is a deflection from normal relation of the teeth to another teeth in same arch or to the teeth in opposing arch is called as malocclusion. So this classification again given by the Gardner and White and Litton. So what are the need for classification? So we'll discuss what is the need for classification. Basically, the classification, any classification in that matter, whether it is angles, whether it is malocclusion or any classification. Here, the group of orthodontic problems will come to know, and the location of problems to be treated. So group of teeth, grouping of orthodontic problems, then the location of problems to be treated, diagnosis and treatment plan, then comparison of different types of malocclusion, and for self-communication, and for our documentation of the problems, and for patients treatment protocol, and for prognosis. For all these things we need a system of classification. So it can be in the questionnaires or interview or a clinical examination or analysis of models. So these all things, it comes in the database, and then the database into then we can take the database and then we can classify, and then we can sort out the problem list, and then we can go for the diagnosis and treatment plan. Then the next is the method of classification of malocclusion. So basically, broadly they can be classified into a quantitative or qualitative type of malocclusion, or intra-arch or inter-arch problems. Okay, they are basically broadly classified into quantitative or qualitative type of malocclusions. And in that again, second type is intra-arch and inter-arch malocclusions. Okay. So malocclusion, qualitative and quantitative methods we will talk about. So qualitative methods are basically the angles classification and the modifications of the angles classification. It's just given by Dewey's, and then we will discuss about the classification system, Simon's classification, Bennett's classifications, and then we'll come to the skeletal classification, and then lastly the Ackermann and Profit classification. So these are the qualitative types of methods. Then the quantitative methods. Let us see about what are the quantitative methods. The quantitative methods are the bar index, the IOTN index by Shaw, the Musler and Frankel index, and IOTN index and stuff like that. So these are the quantitative methods. So the next is the malocclusion, the intra-arch and inter-arch problems. So basically the inter-arch is the problem individual or a group of teeth. So they are again divided into sagittal problems and vertical problems. So intra means within the arch. So inter is between the two arch, upper and lower arch basically. So sagittal problems, in that intra arch, the sagittal and vertical problems. The sagittal are the labioversion, lingoversion, mesoversion and distoversions are, we can again subclassify. And in vertical problems we have a supraversion and infraversion. So supraversion is because of that then you might have a deep bite, and intraversion is your open bite. Okay. So the inter-arch problems are again divided into sagittal and transverse. Again these are also divided same thing, but in sagittally they are classified into class 2 malocclusion and class 3 malocclusions. Okay. And in transverse direction we have a cross bite, scissor bite, or some midline shift we can see, and in the vertical again it will come the open bite and deep bite will come. Okay, these are the intra-arch problems. So now we'll discuss about the angles classification of malocclusion, which is universally accepted malocclusion, and worldwide it is because it is very simple. malocclusion to classify, and it is universally acceptable. So in 1899, the Edward H. Hangel published the first classification of malocclusion. The classification are based on the relationship of the mesobuccal cusp of the upper first permanent molar, so which will occlude in the buccal groove of the first permanent molar is called as Hangel's classification, class 1 malocclusion. Okay, so again Hangel's classifications are classified into Hangel's class 1 malocclusion, class 2 malocclusion, and class 3. And the class 2 malocclusions are divided into division 1, division 2, and subdivision. And class 3 lastly divided into a pseudo class 3 and a true class 3. So Hangel's class 1 malocclusion, as I told you a while back, the mesobuccal cusp of upper first permanent molar occludes with the mesobuccal groove of the lower first permanent molar, but the line of occlusion is incorrect because of malpose teeth, rotation, or other discrepancy are present. That means the occlusion will be in the class 1, but we will have a crowding or any malpose teeth or rotation or discrepancy. This is called as basically the class 1. The class 1 again they are divided into class 1 crowding, spacing, or a class 1 open bite, class 1 deep bite, or class 1 cross bite, or class 1 bimaxillary proclination. These are the again classification of class 1 malocclusion. Okay, I think this is clear for you. So next we will go to the class 2 malocclusion, which are widely discussed and very much they are important for discussion. So here again the mesobuccal cusp of first permanent molar will occlude in the, so distobuccal cusp of the upper first permanent molar will occlude in the molar first permanent molar the buccal groove, and this is called as the class 2 malocclusion. So class 2 malocclusion is the one where the molar is class 2 and incisors are class 2, and we also have a jet and increased overjet, increased overbite. We have a hypotonic upper lip, and we have a mentalis muscle, hyperactive mentalis muscle, and we have a hyperactive buccinator muscle and hypotonic upper lip. And arch is V-shaped, and the profile is convex, and divergence is posterior divergent, and the bite is traumatic bite. So these are the few classical and clinical features of class 2 malocclusion of division 1. So division 1. So division 2 will condition where the class 2 molar relation is present with the retroclined upper central incisors, upper lateral incisors which are proclined normally, and overjet is usually minimal or maybe increased. So it is called as deep overbite, and the tonicity of the muscles are normal. All the tonicities of the upper lip, the mentalis muscle, the hyperactive buccinator muscle, or everything is normotonicity. That means the molars, all the muscles are normal. And the profile is also a straight profile, and we have a divergence, straight divergence. So almost they look like a class 1, but dentally they look class 2. Okay, so this is it is called as div 2 in the short. This is called as class 2 division 2 malocclusion. So next we will go to the class 2 malocclusion with a subdivision. What do you mean by subdivision? The condition when the class 2 molar relation exists on only one side with the normal molar relation on the another side. So this is called as subdivision. So basically the treatment plan is same, but they are again divided into subdivision, that is class 2 division 2 or division 1 subdivision. So this is the one classification we have. And lastly come to the class 3 malocclusion. So class 3 malocclusion is the one, as I told you, the mesobuccal cusp of the upper first permanent molar will occlude on the dental groove between the lower first and second permanent molar. This is called as class 3. So class 3 molar is the molar where we have due to occlusal primarity, when the mandibles there is again divided into pseudo class 3 and a true class 3. So pseudo class 3 is the one, it is because due to the occlusal prematurity 1, or maybe due to the postural class 3, that is also called as habitual class 3. This is pseudo class 3 wherein it is called as, because of the habit the patient will be getting mandible front, and it is called as pseudo class 3 or a postural class 3. Okay, and the next classification is class 3 true class 3. True class 3 is the one where the maxillary arch and mandibular arch will have a skeletal discrepancy, and from the skeletal classification they have a skeletal discrepancy, and a dental also the upper anterior teeth will be proclined, and lower anteriors will be retroclined, and many times we see the cross bite in the class 3 relation, whether it is pseudo class 3 or a true class 3. In a true class 3, the bite will be exaggerated, pseudo class 3, the cross bite, and there might be a posterior cross bite also, and then the convexity, profile will be the concave, and divergence will be the anterior divergence. These are the few clinical features of the class 3 malocclusion. And class 3 malocclusion, again, they are divided into subdivision also. Subdivision is class 1 or class 2 on one side and class 3 on the another side. So this is class 2 pseudo or true class 3 with a subdivision. Okay, fine. I hope you understood everything. Then the validity of angles classification. What are the merits and demerits? So any classification, they will have a merits and demerits as such, and here also we have in the angles malocclusion. What are the merits? So merits are, it is easy, very easy to classify, and most practical method which is used throughout unions, and it is very rapid and it can be done very easily, and it does not require any instrumentation, and it is easy to communicate and widely used for the teaching purpose. These are the merits of the angles classification. So demerits are incorrect hypothesis. Angles considered only in sagittal dimension, not in the vertical or in transverse position, and it cannot be applicable in the deciduous dentition, and it cannot be applicable when the molar is missing. So these are the demerits of the angles classification. So the modification of angles classification has been done afterwards, and there are two modifications of angle classification. One is lysis modification, and another one is device modification. So what do you mean by a lysis modification? He introduced the angles classification into neutro-occlusion, disto-occlusion and meso-occlusion. So neutro-occlusion is the one where he assumed that it is a class 1, where the skeletal, the maxillary and mandibular relations are in normal this thing, and in disto-occlusion that is called as class 2. The class 2 is the mandible is placed distal to the maxilla, so that is called as disto-occlusion. And he called meso-occlusion as a class 3. So meso-occlusion is the mandible is placed mesial to the maxillary arch, and hence he called meso-occlusion as a class 3. I hope it is clear. And then we will go to the device modification. So device modification divided into angles class 1 and class 3 into a further subtypes. So class 1 and class 1 he has again subdivided into type 1 to type 5. So type 1 is the one where the crowded maxillary anterior teeth, and type 2 is a proclined or a labial version of the maxilla, and type 3 is the anterior crossbite, and type 4 is a posterior crossbite. And class 3 he divided into type 1, type 2 and type 3. Type 1 is well aligned teeth with a dental arch, that is edge to edge relations, and type 2 is a crowded mandibular incisors, and type 3 is crowded maxillary incisors and with the anterior crossbite present. So this device modified the angles classification into again 3 subclassification, right? I hope this is clear. And next we will go to the Andrews 6 keys. So what are these 6 keys? Why the Andrews has given 6 keys? So this is called as extended angles classification. And for any malocclusion, so he said that he should have first the correct molar relationship. So correct crown angulation, the correct crown inclination, that is class 1 relationship, and no rotation present, and teeth in tight contact, the 5th one, and the 6th is your Bolton discrepancy. Okay, so then we will go to the skeletal classification. What is skeletal classification? It is considered the relationship between the maxilla and mandible in anterior posterior direction. So what is class 1? Where the maxilla and mandible are in harmony with each other. That means there is no skeletal discrepancy in the maxilla or mandibular arch. They are called as class 1. Okay, and class 2 is where the maxilla will lie ahead between of the mandible. So maxilla might be a prognathic or mandible might be retrognathic, or both the combination of the maxillary arch, the prognathism of maxilla, and combination of the retrognathic mandible. So this is called as skeletal class 2. So then to move into the class 3, so class 3 the maxilla lies to the posterior to the mandible with a reference to anterior cranial base. So wherein we have hypoplastic maxilla or retrognathic maxilla, or we have a short maxilla, and in combination with the prognathic maxilla or a large maxilla or forwardly placed mandible. Okay, these are the combination or the combination of the hypoplastic maxilla and prognathic mandible. This is the skeletal class 3 malocclusion. Okay.